So I'm going to show you how to use templates. So if we add a consultation back on for this patient, I'll show an in-face one, that's fine. So say I want to access a template, I would press F12. And then you will have your main menu. So that is the only one really that you should be using, the Woof Hop main menu. If you double click it, you'll see you've got different options now. So the care navigator are the receptionists who are booking the consultations. You've got admin, calculators such as CHADS, VAS, QRIS calculators that you might want. The doctor's menu, which is the one that you'll be using the most. You've got documents and letters. Within the doctor's menu, there are other options including GP templates, but there's just a shortcut to go straight to templates there. So let's say we click on doctor's menu. I could go back to the main menu. I could look at templates, letters, leaflets, calculators, or long-term problem letters. So there are chronic conditions. So let's say I want to look at templates. So let's have a look and see what I want to do for this gentleman. So these are all the templates that we have access to as GPs. You've got a clinical assessment one, joint injections, hypertension. New diagnosis for cough is a fantastic one. So we'll look at that as well. Some end of life stuff, and it's worth just spending time and having a look at all of these templates that we've got about what things go on them. So say for example I'm going to use a clinical assessment one. They are a bit slow unfortunately, so you just have to wait for that blue circle. So it automatically knows that this was an adult, not a child, so it started on the adult page. So you could write your history and examination plan here if you wanted to, and it would still go into those boxes in consultation. You could add the temperature, pulse rate, blood pressure, respiratory rate, SATs, whether they are on oxygen or not. You could see whether there's rashes, chest's normal, it's just short answers. So if let's say I'm going to add that on, I'm just going to put that on there, that is 37 degrees. You've also got access to all these other ones here as well. So if it was a child, you've got some child things here. Let's pop that down so you can have a look at those. This is handy. It gives you the green, amber and red child observations, so you can always have access to that. You've got a new depression template that helps you remind what you need to do with a review, back pain, DVTs, pregnancies. So it's really worth having a look at what are on these templates because they're really handy. But let's say that's all we were going to add in was just those few on the clinical assessment template. When you save it, you can see this has gone into the examination section on his consultation. Now, if you wanted to change that and think, oh, actually, there was some rebound tenderness, this is just free text, so you can change it, do whatever you want to do with it. If you want to delete that bit altogether, just delete it. And then you just got to then delete the free text as well, unfortunately. It's quite handy and definitely worth having a look at templates. So if, for example, we go back to our menu of GP templates, the one that we really need you to do, a new diagnosis for cough. Say, for example, this gentleman had come to you and they'd had some hypertension. To get paid, we need to make sure that everything is recoded, and for his good care, everything needs to be recoded. So it's worth, every time you have a new condition, speaking to your trainer and going through the template together so that we can get it done right. So for example, this man, he would be coded as essential hypertension. You can see he's already coded actually because it comes up over there. I should move that out of the way. You want to calculate his Q risk. We can recalculate it there and it's come up there. You could have a look to see whether there's any of these things on for new patients. You can look on the management plan for doctors, which is this bit here. So this is about the fact that we're saying what's his target blood pressure. So QOF is telling us these bits here. So this is a 28-year-old gentleman. His primary preventions, he should be 140/90. So somebody's put that on. If he had diabetes, he'd be 140/80. And you can see previously somebody's just put, obviously this is a test patient, so it's not real. So they've put him down as 140/80 as his target. It would then tell you what to start. So this gentleman is 28. He'd be very unlikely to have essential hypertension, but let's pretend he has. And we're not worried about secondary causes. So we would start him well, he's under 55, so we'd start him on an ACE inhibitor first. So we click that box, click save, and then the management plan will be in the notes. So you can see here it's a bit wordy to start with, but it's just covering all the bases. So it's saying stage 1, we're going to give him ramipril, bloods in 2 weeks, nurtavir in 4 weeks. Then stage 2, if it's above his target, he goes up to 2.5. And say, for example, this is a young fit man, we don't need him to start at 1.25, you just delete that, just start straight on stage 2. And you can change this to whatever you want it to be. So say we're doing ramipril, once we get to 10 milligrams, if he's still not to target, we'd add amlodipine in. If it was still not to target, we go to 10 milligrams. If it's still not to target, then we'd add indapamide. So from one template, you have done a whole plan there for someone to follow. So templates are really helpful. They're your friends. Get to know them.